Hey everyone, it's Dr. Doug here, and I wanted to share this really interesting experience I did, which is I got a full body MRI. And I went to the place where I always send my patients to get MRIs of their neck, lower back, shoulders, knees, whatever, when they have MRI needs. The reason I'm curious about it is at this point, after 27 years of practice, I have a lot of chronic pain, my shoulder, my left knee, my lower back every once in a while. And so I was curious about that. In addition to that, I have diabetes and heart disease in my family. Most of the men in my family have already had heart incidences by the time they're my age now. And on top of that, I've also, which I've shared a little bit, I've also got skin cancer 3 times from my exposure working down at Ground Zero during 9/11. So I'm curious about cancer, I'm curious about heart disease, diabetes, and general pain. So I thought, why not? I definitely want to do this. And you're going to see in a minute my experience getting it done. I think this is a big benefit for people to investigate with their own health because prevention is a big deal. I think this is worth the investment, even if you have to go out of pocket, because insurance, I don't think, covers this too often. But it might be something you look into so that you can prevent future catastrophe and know it way in advance so you could do something about it. This office is absolutely beautiful, and it's one of the reasons why I send my patients there to get their MRIs, because they have the highest technology. Everything about it is first rate, and I just think it's a beautiful office, and their customer service is first rate, and their MRI quality is off the chart. So the clarity and sharpness of the MRIs that they produce are amazing. I was a little concerned because I've had MRIs done before of my head and my shoulder and my neck and my lower back. And those lasted, if I can remember correctly, around 20, 25 minutes. And this is definitely double the time. It's somewhere between 45 minutes and it can be as much as 60 minutes depending on what they focus in on the scan. And I just remember that I got my mindset like I'm going to just relax and hang in there. And I did. I breathed, I relaxed. I'm the type of person that wants to reach up and scratch his nose, but you can't do that. So I think that was my biggest concern, is like, what if my nose itches? But I got through it. The music helped. They blast music into the MRI chamber, and it went pretty well. It wasn't bad. So what sets the full body apart is that it's a comprehensive evaluation. We're talking about head to toe. Now, you're going to check organs and all the soft tissue of the body and the hard tissue of the body. You're seeing everything. And to me, this is really important because it's the thing that you miss that could kill you one day. So we want to see this stuff up front and fast, and you want to see it before it has time to manifest into a real big crisis in your body. That's the main reason. And again, early detection is key. Anytime you can see a tumor, a cyst, a mass that shouldn't be there, you want early detection. We spot it early, and then we have choices. If you don't spot it early, sometimes there's very little choices left. Another cool thing about the facility that I went to is it uses non-ionizing radiation, and the ionizing radiation is the cancer-causing type. So this is the safer type of radiation. If you had to choose between two, this at least is the least invasive possible and will cause the least amount of harm to cells. Again, I mean, depending on where you go, but this place that I went to has the detail and the measuring device and the software that they can analyze an area. So if something does show up, they can kind of triangulate it, zero in, and really dig deep to see in detail what that cyst might be or what that abnormal structure might be indicating. And so the layers of observation and the layers of research and study that can be done on this imaging is off the chart. And it's the state of the art of what's being available today.
For the lumbar spine, overall looks good, right? So
What is that one there?
it's a little bit bulging, yeah. So L4, L5.
Oh, and
this is L5, S1.
so I herniated those a few years back. Do you see anything on the left side? That's where I had most of my symptoms.
You do have a neural foramen narrowing too.
On the left?
Yeah, I see that. But look at on the muscle wise if there is muscle injury there. But it looks good. The rest is fine, actually beautiful.
Excellent. I have a good spot.
You do have, and then we have, let's go look at this thing. So we go from brain, okay?
Oh no.
So these
Are those
your
my
goals.
eyes?
Yes. You have a septal deviation towards to the left, mild degree,
Show me the septum deviation.
right here. See this? So you're probably breathing right, nicely on the right and left. If you could plug it in.
Yeah, my left is not so
Oh.
good.
So that's what I'm saying. We were figuring out what you ate this morning. Hold on a second.
You could tell what I
I
ate?
can assume it's gonna be either bagel or some sort of muffin or something.
No, I didn't.
Because look at this junk.
Oh, I had a bowl of cereal.
Really?
Yeah,
It's clumped.
and almond milk.
Oh, it's probably clumped. That's why. And good muscles. Look at your legs. Very nice. Then, so we'll look at the coronal view of your upper body now from brain. These are your globes. And we look at basically if there is muscle edema, muscle tear, or anything that is basically suspicious in the subcutaneous soft tissues.
Yeah.
Uh,
I'm always curious
and the
about my
hurts.
left shoulder. Everything on the left hurts.
You have a little bit of rotator cuff tear,
Mhm.
anything like that, because these are very thick slices. But I can tell you there is some degenerative change in the humeral head.
Yeah.
You see that? You don't have a lymph nodes in the neck, it's all good. Not much sinus disease.
What do my sinuses look like? Because they always, the left one always seems different than my right.
This is the left,
Yeah.
that's the right.
So they look pretty equal.
Pretty good. Your frontal sinus is all good.
Just a deviated septum.
Yeah. Did
Yeah.
you crack your nose too?
Yeah, I've broken my nose before. I played rugby,
Oh.
and I also wrestled, and they got my face smushed a few times. Yeah, my left hip is very tight, no matter how much I stretch.
Mm.
Does the left look different than the right, or about the same?
About the same. A little bit more on the left than the right.
And what did you call that? Arthrosis? Like,
Tendinosis,
Oh,
the
tendon.
attachment site.
Yeah.
So when tendon attached to the bone, so you get this inflammatory changes.
Mhm.
These are your fingers, part of it.
That's my glutes.
Yeah, nice glutes, symmetric.
Thank you.
And we're gonna look at your fat intensity changes in your liver. So to see if you have a fatty liver or not.
Okay.
Based on this calculation, I don't think you have fatty liver. Okay? We'll measure it now.
That would be good to know about.
So 90, no change. So it tells you that you have no fatty liver.
Good.
Thumbs up. And we did a dedicated pancreas to look for cyst. But you don't have anything. Okay. And look at your neck. And focusing on the thyroid gland. And that looks good. And we have another dedicated thyroid right here. That's your thyroid gland.
Mm-hmm.
Looks nice. That's your brain. Very symmetric. Your mostate air cells are good. Very nice. Look at the upper body. Sometimes incidentally you can see lung mass. Even this is MRI.
Mm-hmm.
So we actually image your knees. This is the lateral meniscus. You see that?
Yeah.
Black band, a little bit of signal that is basically indication of it could be a partial tear or some sort of tear.
Yeah.
In the medial meniscus. Is actually the posterior horn.
Can I get the pain here?
Well, so that's pretty much what that is.
Is it?
Yeah, I mean, this is medial posterior horn.
And would it hurt on the edge, you know?
Yeah. And you have some...
so that could be a tear?
Yeah, I mean, we have to do when you come back, we'll do a dedicated one, but looks like this should be black signal.
And it's fuzzy.
This one, it's fuzzy. See, this is black.
Yeah.
See that? This is not black. And in fact, there is fluid here too. Overall, conclusion, you have this disease.
Where?
This cervical spine.
Yeah.
Which you already know it.
I knew that, yeah.
And the rest of the body looking good.
Yeah. I'm so glad I came. This is so cool.
After having done this, I just feel a lot of relief because I do have a lousy family history with heart disease and diabetes. My grandfather died young, and I really resemble that part of my family the most. He was a brittle diabetic and heart disease, but it's through both sides of my family, actually, my mother's and father's side, plus all my injuries, and just this sense of doom and gloom sometimes. Like, I sometimes go like, what's going to get me? I worked my whole life and then I'm going to die of some horrible disease. And that always hangs over me as this thought in the back of my head. And now I'm not necessarily in the clear because I could die walking down the street in New York City being hit by a bus, but at least I know that I'm not incubating some type of lesion or cyst or tumor that I don't know about that's in its early stages. I'm clear for now. And that feels really good. It's such a relief, and I feel like I can sleep better, not worry about it so much. So if you're in New York and you want to go to where I went, here's all the information. Dr. Aras is amazing. He's there every day. He reads the MRIs. He's involved. He's not only the owner and the director, but he has amazing credentials and is involved in all the research and all the work that's being done here. I can't say enough of his professionalism and his expertise. And it might even be worth driving an hour or so to come to this place to get it done right. New York's a big city, and a lot of people can get here or will be here at some time in the next year. So you could schedule it during a business trip or something else. But I can't say enough about the experience and the relief that I feel that I had this evaluated and got a chance to take a snapshot of what's going on in my body right now.